Hello. So today we're just going to be talking about a few signs that will help you as a chiropractor, health professional, when you have a deaf patient in your office. So we're going to be going over a few signs from the last video if you didn't catch that one. And the first sign obviously is just kind of an introductory. So you just want to say hello when you have a patient, or you could do hi, and then you want to start by introducing yourself. So my name, and then you just sign your name. So in my case, Dr. Beck. Then you can say, how are you? So it's just putting your hands together like this, folding them out. How are you? They could respond a few different ways. They could just say good or good. They could say bad. So just take a slightly sign for good, but then you turn your hand over. And you can do it either single hand, so this would be good, this is bad, or you can do it into the other hand. Bad. They could sign okay, they could do fine, and they may say, feeling so, happy, sad. But usually they'll do more pain-related questions. So they could say, in pain, and then you might want to ask them, so pain where? And they could do a couple different things. If they had like a headache, they would do pain over their head, or they might like indicate to their back. And in that case, it would be here, indicate to their back, and then do pain, or you could do it like over the chest pain, wherever they have a problem. So then some follow-up questions then would be, you could do pain, and then you do when, and start. So pain, start, when. So here it is. So here, this is pain. When is just hold this steady and just make a circle. When. And this is the sign for start. So if you can see that, like start. And then they'll of course answer the appropriate question. The other thing that you want to introduce them is just explaining who you are. So the sign, you can do chiropractor. You can explain that you take care of your spine, do adjustments. You can explain that you're a doctor. So in this case, you take your non-dominant hand. For a lot of people, that would be your left hand. The right hand makes a D, and you just tap it against the wrist. So you're a doctor, and you're here to make you healthy. And then you can continue the conversation from there. But just to refresh, just remember, this is pain. And when someone wants to show you where the pain is, they'll just do the pain sign over the appropriate area. This a lot of times indicates back. And then you can explain when you're ready to adjust them. You can ask them ready, so it's the R sign here, and then you can just tell them you go face down on the table or face up on the table. So these are just some good introductory questions and signs that you can use for a deaf or hard of hearing patient. Remember that they will sign that they are deaf. You can explain that you're hearing, or in some cases they may be hard of hearing, and you sign, and any of those will be helpful. Alright, thank you, and I'll be back with some more signs later.